Thank you for a fantastic presentation from all of you. As a question of a parent of a child with XLRS, I have been quite surprised how there has been no support provided at all after diagnosis. So while we've commissioned many SEND reports over 6 years, the child is out of school, was diagnosed at the age of 5, was not provided, managed to get an EHCP at the end. The local council for nearly 6 years has not spent a penny, will not support the child, has been unable to find a school, so the child is at home, and was then sent to a private school where the private school was funded by the parent, but the private school refused to put in the simplest adjustments like providing appropriately modified materials, access to the class interactive whiteboard, or extra time for tests. And so this went on for 5.5 years. And even when independent education psychologists say that the child is very high ability and can go to a grammar school, the grammar schools just take totally inappropriate tests conducted by some school with no provisions or access arrangements, and then just use that to reject the application. So where do we stand in the UK for children who are deliberately obstructed and denied, and what are the routes? Because obviously there's the SEND tribunal route, but having gone there myself, generally the local councils will withdraw their objection after a year, but then they play the same game over and over again. So what is happening for children who are deliberately obstructed and denied by both schools and local authorities, not provided even the simplest reasonable adjustment, and they're homeschooled? And this is something that I feel very strongly about, and actually even academics in North America that I've spoken to feel very strongly about, and they tell you that this couldn't happen in North America at all. Thank you.
Thank you. Have you got anything to add on this one?
The only thing, one of the things that, again, the VI Charity Sector Partnership are looking at doing with guide dogs actually specifically is a children's support pathway. So, the one that I've talked about today is very much around the adult pathway, but there's work going on around children's. But in terms of your specific experience, it doesn't sound right, that. It doesn't. So, I don't know, it just doesn't sound right. It doesn't sound like that you've been given the right information or the right support. So, that'd be something I'd be looking to challenge. I know both, RNIB, we have an internal legal rights team, a team that would be able to potentially advise and support with obviously the support of Retina UK. That might be an avenue to look down, but it doesn't sound right what you've explained.
I think the best thing will be if one of our team have a chat with you at some point today and speak about how we can take it out of the meeting today and have a conversation about how we can best support you with that. But incredibly frustrating and disappointing to hear that that's happening, and I do wonder whether it's partly down to postcode lottery. I think the people in the room probably have very different experiences dependent on where they live, which isn't acceptable. But yeah, let's pick that one up. Thank you for your question. Got a few more in the room.
Well, thank you. Thank you. Good morning, and it's so nice to be here this morning. And my name is Krishna Place. I'm coming from Glasgow, actually. My question is based on the lovely talks given by Kate and Martin. Basically, I'm a long-term visually impaired person, actually, almost now, I would say about 40 years plus. So I think I got a lot of inputs to make with regard to basically the disease I'm suffering from and the various problems, causes and things like that, which I believe would assist research in a big way. So I would like to basically be part of pharmaceutical companies' research efforts in a way I think I can add a lot of information to that and to assist the research and all that. So what I want to ask Kate or Martin is, what's the first step I have to take so that, my interests are registered and I can kind of make some kind of progress with that, because I think I got a lot of things to add there, so contribute, so I don't want to miss out on that. Yeah. Thank you.
I'm happy to say a few words. Thank you so much for the question. What we would always say to anybody who's interested in getting involved with any of our research at Janssen is to speak to your patient organisation. So speak to somebody in Retina UK and just register interest in getting involved in this type of activity. Patient organisations do form that really important link between individuals and the pharmaceutical industry.
Can I just reinforce what Kate has said there? Because as I mentioned in my presentation, it was through Retina UK that I was approached, and it was essentially Kate Arkell who's got the key contacts with all pharmaceutical companies of interest, and the participation through Retina UK was, if you like, the opening, the way in which you get involved. So I'd thoroughly recommend that route.
So that means, can I just drop I'm a Retina UK volunteer already. So that means, can you just drop an email to Kate actually, kind of registering my interest actually, and take it from there?
So the best way to do it is to sign up to our lived experience panel. And anybody in the room and those at home can choose to do that. So there's a link on our website, or come and see one of the team today. We'll sign you up to the lived experience panel. We take a little bit of information from yourself. If you have a genetic diagnosis and you're happy to share that with us, we'll take that. But what it means is if we are approached by biotech pharmaceutical companies, anybody with an interest in our community, you've given us your consent, and we can put you in touch. We'd never share your information without your consent, but it just means that we can play middleman, if you like, and make that link. So lived experiences panel is the way to do it. Thank you.
Thank you.
Another question?
Good morning, and thank you. Your presentations were brilliant. I have a question for both of you, and it's still alarming me to actually hear this. I work for a local sight loss charity, also volunteer with Retina UK, and the thing that's coming out of the clinical pathway that people do not know what services are available post-diagnosis. I was actually diagnosed many years ago, and I was shoved out the door, quote unquote, with leaflets and be told to get on with it. Nobody knew of ECLOs, low vision, nobody knew what it meant, and it's still happening today. Consultant ophthalmologists sometimes do mention social support, but how are we going to move forward in a positive way? Not only to provide it from a very young age, but now, to stop the kind of hurt, the emotional trauma people are feeling.
So yesterday we had the professionals conference, and we're reliant on professionals to change potentially some of their behaviours and to increase their knowledge. So we are working with the Royal College of Ophthalmology, the College of Optometrists, and we are working with some of the health bodies, education bodies, to look at how we take this pathway, this support pathway, the things that you've all told us, to make sure that actually curriculums of the future embed support services, so that when we've got our junior doctors coming through their training, that they start to get training on the support that's available, not just the clinical aspects. So that is something that is part of the whole implementation plan, but that's why we've got the collaboration with all the bodies across eye care to make sure that because we are going to have to change behaviours.
At the same time as working collectively through the VI Charity Sector Partnership, we've got our own work going on at Retina UK as well to encourage referrals from health and social care professionals at whatever point somebody might be on their journey. And I think it's really important for those health and social care and education professionals to never assume that anybody else has explained, what people are entitled to, the fact that we exist as an organisation, because we know, unfortunately, it's not happening often enough at point of diagnosis. So we've got a particular project running this year that we've got some funding for, which is all around enhancing understanding with professionals. We actually asked them, those that joined us yesterday, we had about 300 people join us yesterday from the professional community. We asked them directly about how we can better support them, what resources they need from us. So it is a big focus for us. It's not good enough at the moment, and we've got more work to do. But as I say, working collectively with others in the sector and individually as Retina UK, I am very encouraged that we will make progress, not least because so many people chose to join us yesterday at a time when we know they're really busy in their roles. They made the time to come here or join us for a day, and I think we should take heart from that.
And then just the other thing on that, NHS England have just put some funding out to ICSs, ICBs, integrated care boards across England. And this was specifically around how we improve the digital pathway, actually the flow of data and information. One of the things that was included on the service specification for that funding, and it was point number 2, those pathways that they're developing had to show that they were incorporating patient support. So if they want that money, they've got to demonstrate how they're going to embed patient support into their future pathways. So that's a starting point.
A question from home?
Yeah, a question from online. James, how do you persuade all of these famous people to contribute to your events?
Do you know, honestly, it's literally the most asked question. I'm very persuasive. I think, do you know what it is? I think once you get one, whether it's a judge or a virtual video, it's easier to get others. And I think because the event's been going for so long now, I can just literally bullet point all the kind of statistics of what it's achieved. And I kind of name drop other people that have been involved, and then they all want to be a part of it. But it does make it harder for me year on year. So, yeah, I don't stop. Like Piers Morgan, I didn't actually hear from until like a week before the event, and I was like, I'm just going to try again, and then he did it. So it's just a lot of hard work.
Any more questions?
Yeah, so mine isn't a question. I just wanted to tag on to what Rob in particular was saying there. I'm really sorry that you haven't had the support services. I qualified as an optometrist in 1987 and worked in the hospitals, and have also been a university lecturer in low vision. I just want to give some reassurances that things are getting better. When I qualified, I had very, very little taught experience in low vision. I was very lucky to go to one of the RNIB's rehab places down in Torquay as an undergraduate. But things have changed, and we teach low vision in a very different way. When you qualify as an optometrist, you do what we call a pre-registration year. So that's after graduation, before you get your full qualification. And low vision's always been a competency to pass. Now, there's not a lot of good things that have come out of COVID, but one of them is that our pre-reggers couldn't come into our hospitals to get the experience, so we went online with it. So now we know that our pre-reggers for the last 2-3 years have been getting a much better experience for low vision. And I personally present on behalf of the College of Optometrists such a session. We've gone down to once a month now. We were doing it 3 times a month at the height of the pandemic. So once a month, all of the trainees come on, and it's now part of their competency to pass. It's a full 4-hour session that we do, and we really do, you know, it has to be a holistic approach to low vision. So I just wanted to let you know that optometrists are their sort of involvement in low vision, but their knowledge of the support services is getting better.
That's
so
great to hear. Thank you for sharing. Yeah. Another question?
Hi there. This is not really a question. It's in response to the gentleman who asked the question about his daughter not getting support in education. I'm Seema Flower, the founder of Blind Ambition, and we actually work with people like yourselves with disabilities who we find this all the time. So please, if you can try and find me, we can try and help you move this forward.
Thank you, Seema.
Another one from home. Rob, could you just confirm whether the Pathway project covers the devolved nations or whether it's just England?
Yeah, good question. So at the moment, it's very much focused on England, but with engagement with UK-wide bodies. And what's going to happen once this, because the support needs are the support needs. It doesn't matter where you live, you still need the same support. But what we're doing specifically with obviously Wales, Scotland and Northern Ireland, because they're devolved, we have to make sure that the pathway is in the context of those devolved nations. So the idea is that we're working on the kind of the overarching and the core principles around the support needs, and then we will tailor it to each nation. So yes, it will be across the UK. And the bodies that are very much helping us, like the College of Ophthalmology, College of Optometrists, etc., like yourselves, the UK-wide bodies. It's just that we had to start somewhere, and obviously England's, because of the level of engagement, we've got good engagement across all the nations, but we've had specifically good engagement with NHS England. We've got Louisa Wickham, the new National Clinical Director, who's been very much engaged in this whole piece of work. So yes, but it will be a UK-wide pathway.
Probably just worth adding as well, if I may, Rob, that in addition, you know, this foundation piece that's happening at the moment, it's very much our intention at Retina UK that we will create a pathway specifically for inherited sight loss. So actually this pathway will be for sight loss in general. It will have had input from Retina UK and our community about the differences of an inherited progressive condition, but actually then our plan is to take that and to own that and make it into something that is unique for our community.
First and foremost, thank you for all the excellent presentations. As someone who's lived with RP for rather a long time, now retired and worked for the RNIB for many years, I wondered if Rob might expand a little bit on the fact that I'm actually quite shocked that earlier this year I was asked by the RNIB if I would say a few words in the public arena about their need to launch a campaign called My Info, My Way. The information standard for the NHS was launched many years ago, and yet I personally, and I know many others have, also had to fight rather hard to get any information in an accessible format. I mean, as we've been saying, people are given leaflets and bundled out the door. I don't know, it's just quite shocking that this is 2023, and the NHS, which is in many ways excellent, but the information they provide for people like us is often quite shockingly poor. And I wondered if Rob had anything else he might add.
You're right. Accessible information is a significant problem. And that is something that is being identified across every part of the pathway work, that information needs to be provided in an accessible format, whether that be digitally, whether that be physically through leaflets, etc. You know, then we need to make sure that it is accessible for everybody, and that is something that we've been very much working with NHS England on, NHS Digital on. But the big challenge we've got is that implementation in every region across the country, because they all do it differently, and they've all got their own ways of providing information, and we've got to try and get, as part of the implementation plan, is get those areas to really understand accessibility and making sure that we've got the accessible information standard, holding people to account. So yeah, it is a big issue that we're trying to address, and it is very much intertwined within all those, the pathway work.
And that's why, you know, this partnership is so important, because it's on matters like that our voice is stronger, that, you know, the RNIB do have more clout around this kind of thing, but actually we can make sure that Retina UK and other patient organisations are adding our weight to the argument as well, and making sure that everybody is being heard. So yeah, that's how we're stronger together. Retina UK probably wouldn't be able to have the reach if we were doing that work on our own, but to have the opportunity to input into what RNIB are doing is really useful. Any more questions? Oh.
Hello. Hopefully it's appropriate at this time. I don't know if it's better.
I'm not sure that mic's working. Can you hold it a bit closer, please?
Is that any better?
Thank you.
Oh yeah.
Yes.
Okay.
Thank you.
So just a couple of points really. The first one in terms of the pathways and the genetic testing. So what I found is we've had genetic testing, but it's really hard to sort of make connections with other people that have the same mutation. And I think with the one that we're affected by, it's quite rare. So again, is there any way that can be improved, or any forums? I am on my Retina tracker, but I think there's only 7 people logged on with the same gene on my Retina tracker. So it was just that, which then leads me into my next point, I guess, about research, because then there's less people available for this particular gene. It makes it more difficult. But then with the research and the fundraising, where are the decisions made in terms of what projects to support. I'd be interested in, for example, I've spoken to a professor who's done some research on this particular gene that we're affected by, or my son at least is. But again, it's that fundraising. They'd need to redo the mouse model to test the efficacy, but there's no funding. So even when we've got a professor and we've got a team, it's that funding bit. So where do we put sort of decisions to from that perspective? And I know some of that will tie in this afternoon with research.
I think it probably will actually. As far as making connections with other families is concerned, as we mentioned earlier, the lived experience panel, if you're happy to share with us your details and the genetic diagnosis, then there will be opportunities potentially for us to hook you up with other people. And we know it's really important for people to make those connections. As far as your research question is concerned, I'd prefer that we take that this afternoon, if that's okay, because we're going to have a number of experts with us. And I think actually you'll get a better answer to your question when we've got that expertise. So please, we'll make sure we do come back to you this afternoon on that. Is that okay? So Matt's given me a thumbs up, so I think that means that is the end of this session. So thank you everybody for listening so patiently. I hope you have a better understanding of how Retina UK works with other organisations. There are times when we are Retina UK and there are times when we are Retina UK part of a wider collaboration. Thank you to everybody who's joined us for the session, either online or at home, for all of our panellists. And thank you very much.
Thank you.